Here in the room if you're one of the media folks present. Yesterday we obviously gave you a lot more information than normal, so today's prepared remarks are relatively brief, and then we'll get to your questions. So getting right into the latest numbers that we received today, we are reporting 218 new cases. That brings us to a total of 27,286. And so obviously that is a good number to report on a Tuesday, because there have been some times when Tuesdays were really high. The other good number is that's on a total of 4,119 new tests. So the percentage of tests that were positive was 5.3%, which too is encouraging. Unfortunately, however, we do have 61 new deaths to report today. And you know, you've been hearing me report similar numbers for a long time now, and I don't want anybody to think that these are really numbers. These are obviously people, and this is very tragic. Obviously, I and the rest of the state are very much looking forward to the day when the number of deaths is zero. And it's also true that as we reported, I think it was last week, the number of deaths is higher than we would expect it to be, given the number of cases that we have and the rate of transmission that we really think is going on. And we're continuing to look at that and trying to figure out why that is. Currently, we have 1,666 patients hospitalized, with 244 of those on ventilators. And the grand total of tests that have been completed is a little over 151,000. Interestingly, today we went back to number 5 in the nation in per capita cases. So because we had slid down to 6 yesterday, I think we just traded spots with Rhode Island today. Speaking of testing, I will tell you that the best news that we had yesterday in the White House's coronavirus task force telephone conference with the nation's governors was the commitment that the federal government made through Admiral Giroir. And if I haven't told you all this, he is a Louisiana native, by the way, and that the task force will support our efforts here in Louisiana starting in the month of May to reach 200,000 tests per month. That's a significant ramp up from where we are right now. We just told you we've done a little over 151,000 tests, and that dates all the way back to early March. So to get to 200,000 tests in 1 month is going to be significant. And it's also critically important because we need to have this testing in place so that we can monitor what's going on out across the state of Louisiana in every community, and it will inform our contact tracing and so forth. So incredibly important that we do that in terms of getting to 200,000 tests per month. We also have new information on the Department of Health dashboard right now. It breaks down information by gender and sex. Today it's reporting, for example, that 57% of the COVID-19 deaths in Louisiana have been among men. Obviously, they're 43% among women. And interestingly, each has 50% of the cases. So you can see this and other important information by visiting ldh.la.gov. Before I open the floor to questions, a couple of other things, one of which is there is severe weather moving across North Louisiana right now that we want everyone to pay attention to. That could continue through the day. So please watch for that. It's enhanced risk of severe weather, thunderstorms, some flash flooding, hail, potentially tornadoes, and that's, I know we've had to make that announcement a number of times over the last several weeks, and it seems to be hitting North Louisiana at a regular clip. But I'm asking people to pay attention to that and certainly keep their cell phone handy, because you will get your last and best warning about a tornado on that cell phone. We've also had many generous donations throughout the course of our efforts to respond to COVID-19, and it's helped to make that response more successful than it otherwise would have been. And I want to thank all of those individuals. You know, at the state level, we've been working with LSU, LBEQ, GOSEP, and prison enterprises to produce enough hand sanitizer to fill approximately 48,000 16-ounce bottles. And all of the raw materials were donated. ExxonMobil, for example, here in Baton Rouge, donated 4,600 gallons of isopropyl alcohol. In addition, they've been manufacturing their own medical-grade sanitizer for our state and for other states who need them. Procter & Gamble in Alexandria has donated 60 gallons of glycerol, and Solvay Industries in Baton Rouge has donated 100 gallons of peroxide. Additionally, we've received more than 2 million cotton masks from Hanes, which have been distributed to parishes based on population. Some of those masks were kept by GOSEP in case we have to do congregate sheltering in the hurricane season or for any other natural disaster. So it's very helpful with those masks. I think you were supporting one of those today, weren't you? Okay. You'll no doubt see and have seen parishes giving these masks out to the public. Each parish will have the ability to decide for itself how to distribute its masks. And obviously, if you have the ability to make your own masks for you and your family, I hope that you will do that and leave those masks at the parish level for those who don't have that ability. The 10 Cent Foundation has donated nearly 400,000 KN95 masks to GOSEP for distribution to the 504 Health Net in New Orleans and to the Biomedical Research Foundation of Northwest Louisiana. You know, I've said many times that prayer and faith are really important to me, and I know to the vast majority of people in Louisiana. And many churches and places of worship have had to come up with creative ways to reach their parishioners as a result of this public health emergency, and many of them have done so. And I'm grateful for all of their hard work to do that and the work that they're doing to help us fight against this disease. And I want to let you know that the Times-Picayune and the New Orleans Advocate and the Advocate, in partnership with Raising Cane's, has created an online directory of religious services called the Faith in the Community Initiative. You will be able to find information on how to stream virtual services, and you can get that information by going to nola.com/faith-in-the-community, nola.com/faith-in-the-community. And that's also where churches would go in order to register on that directory, and if they want individuals to be able to find where they can find their services. And finally, there are a lot of people who are disappointed, and I'm one of them, that the Zurich Classic will not take place in New Orleans this year. It did not take place. However, even though the event's canceled, they're leaving the tournament funds in place so that the roughly $2 million charitable impact of that tournament will still happen. Critically important for the state of Louisiana and the New Orleans area, and very generous of the Zurich folks. And so wanted to call them out on that and just let them know how much we appreciate that. It's very generous. You know, from the very beginning of this crisis, I've talked about how every person in Louisiana has a role to play. And we have a responsibility to stay home, to social distance, to wear masks in order to protect ourselves, our families, and our neighbors. Some have the very critical role, obviously, being on the front lines as healthcare workers. And they have been doing that in tremendous fashion all across the state of Louisiana. And I, on behalf of the entire state, want to again thank them for their heroic work. My commitment, obviously, as the governor, is to do everything that I can to protect the people of Louisiana in this public health emergency. We're going to continue to do that as best we can, guided by science and data, and working with stakeholders across the spectrum. So with that, we're going to get to a couple of questions from the public. I think I'll take the first one, and I'm going to ask Dr. BU to take the second one. We've received a lot of questions recently about masks, which are critical to protecting each other as we continue to work to flatten the curve and slow the spread of COVID-19. And fortunately or unfortunately, I think masks are going to be with us for a long time, and part of the new normal until such time as there's a vaccine and so forth. Kristen asked, at what age should children start wearing masks, and should daycare workers caring for infants and young children wear masks? Masks are recommended for every person over the age of 2, unless that individual has breathing challenges that make it where they just shouldn't wear a mask. And masks or face coverings should be worn indoors and outdoors by everyone, anytime that they're going to be near others who are not members of their immediate household. This does include daycare settings, and it applies to the workers and to the children who are over 2 years old. And I'm going to ask Dr. Bu to come up and respond to a question from Susan, and then we'll take your questions.
And so Susan asks, please demonstrate how to correctly wear a mask and explain the importance of this. So, the governor's previously said that he and I wear masks when we're out and about at town separately. We also wear masks here where we're working closely together with others, and people at home can't see, but your press are all wearing masks as well. And the importance is that when I wear a cloth mask, not a medical grade mask, but a cloth mask, I'm limiting the potential virus that's shedding out of my face spreading to others. And so if we're all wearing masks, we are limiting the likelihood that if any of us are asymptomatic or symptomatic, that we are shedding virus towards each other. So it's important that we do this mutually. Masks, these cloth masks are not designed to protect you. They're really to protect everyone else. And that's why we need everybody to wear them. So if everybody protects everyone else, then you're protected as well. So the proper way to wear one is pretty important, because the way that you wear a mask could make it more or less effective. When you're not wearing your mask, we recommend that you do store it in a bag. Here I've got a clear plastic bag. And I have my mask folded such that the inside part of the mask is covering, is touching together. So I'm not exposing the part that's going to be on my face. And then I put it over my ear and critically try to adjust it as little as possible. And importantly, the mask needs to cover my nose and my mouth. You need to make sure that you've got the right size mask, and if you're making your own masks at home, do a little bit of adjustment and measuring. You want to make sure it's not so loose that the mask is falling down constantly. You also want to make sure that it's not so tight that it's going to irritate you a lot and you have to touch it. The idea is you want to touch your mask as little as possible, and in general, as we've been saying from the beginning, touch your face as little as possible. Next, when you're taking off your mask, and really I should have even done this before I put on my mask, you need to wash your hands because you're now going to touch your face. So put a little bit of hand sanitizer to clean my hands, and now just using the ear loops, taking the mask off, fold it in half. Again, the outside part of the mask, I'm going to fold it one more time so it fits in my bag, and then I'm putting my mask back in my bag, and then I can carry that with me without any problems. I'm going to put this mask on as soon as we're done with the press conference. Luckily, I'm keeping mostly 6 feet away from all of y'all. But really, again, as the governor said, any time that you're around individuals who are not in your immediate household, indoors or outdoors, we want you staying at least 6 feet away, but even better, in addition to that, we'll be wearing your mask as well. Do want you to clean your masks every day. It's important that they stay clean. So wash and dry. You can put them in your laundry. You can hand wash them and dry them. But that's going to be pretty critical. And if they get dirty during the day, you need to take it off and put on another mask.
Thank you. So those of you who hadn't seen the Hanes mask before, that was one of the Hanes masks that we distributed, almost 2 million of those around the state of Louisiana. So with that, we'll take your questions. Yes, sir. Greg?
Governor, you said yesterday, which Dr. Bu confirmed, that you had unanimously from your medical expert team to extend the order. Did you have any counter advice from your senior staff that's not part of your medical team?
No. Of course, and they had the benefit of sitting through all the presentations and looking at the data that we came in across all of the criteria that we were looking for in terms of symptoms, cases, hospitalization, and then also knowing what the timeline is going forward with respect to the testing. I just told you about the 200,000 tests that we should reach in May, and also the contact tracing capacity. And all of that worked together And also knowing that Louisiana is a hotspot state. And if you recall, back when the president released his plan for reopening America, he indicated that May 1st was a good date and that it would work for a lot of states, but not hotspot states. And there's not been a single conversation that I'm aware of in many weeks now, if you were talking about hotspots, where you didn't talk about Louisiana. And so it wasn't a stretch. Now, we were all disappointed because we were all hoping that when we sat down and looked at the 14 days worth of data, that we would have improved to the point where we could safely move to phase one. And that just wasn't the case. But another reason that informed the decision, and which I think led to it being unanimous with the senior staff, was that when we looked at how much of the economy we had left open in Louisiana to begin with, compared to some other states, that we already had considerable parts of our economy open. And again, yesterday we had reopened the non-emergency medical and surgical procedures. We had left retail open if they weren't essential, but hadn't been closed. And obviously we're talking there about bars and barbershops and salons and that sort of stuff. And that we had followed all of the CISA guidance so that everything that CISA had determined, and now it's been through 3 iterations of their listing of critical infrastructure, had been left open as well. So for all of those reasons, we felt the right thing to do was to continue the stay-at-home order for 2 more weeks, make sure we didn't have a hotspot pop up until we had the ability, knew we had the ability to test it, and so forth. And then these 2 weeks just made sense from that perspective. Yes, ma'am.
Governor, some other states have, because of the budget concerns, have started furloughing state workers or doing hiring freezes or spending freezes on non-emergency items. Is that something you're considering for Louisiana statewide, or is it something that even individual agencies have started doing?
Well, we are going to consider whatever becomes necessary for us to do things that are fiscally prudent. The good news for us as we finish up the current fiscal year, as you will recall, we running a significant excess in the current year. I was about to say surplus, but surplus applies going backwards. So we're running a significant excess. We will have an REC meeting in the middle of May, I think around May the 14th, and we will figure out what that number is today. But for the year that ends on June 30th, in good shape. Where the changes will likely come will be the year that starts July 1st, and of course we have to have that REC meeting, and then that's going to inform the whole budget process and everything else. But that excess that we had, along with surplus from the previous year, really has put Louisiana in a much better position than other states. And then the other states have, some of them have different fiscal years. Some of them go from January 1st to December 31st. Some go from July 1st, the way we do, to June 30th. And others, I think, mirror the federal fiscal year, October the 1st to September the 30th. And I don't know where those states are in their budget years, but we're wrapping up one year and preparing for the next. And so that's one of the reasons we haven't had to take those actions, along with the fact that we've had surplus from the previous year and excess in the current year. Yes, sir.
Governor, you talked about the commitments the federal government has made regarding testing. How many specific tests have they committed? Did they commit a specific number to Louisiana? And also, you mentioned the possibility that we're going to start testing asymptomatic people. Yeah. I know in recent weeks you said these tests don't work for asymptomatic people. Can you address why we are now moving to test for asymptomatic people? What the timeline for that might look like?
So the number is 200,000. That was the plan that we submitted, I want to say, last Wednesday. To the CDC. It has been approved, and in fact, when they gave the announcement yesterday in that video telephone conference, I think every state's plan has been approved. We expect to starting next week or in the first week in May, which is next week, that we're going to start receiving weekly allocations. That will increase over time, but will get us to that 200,000. And what we're talking about are those test kits. So these are swabs. This is the viral transport medium, test tubes and reagent. And which, by the way, great news, because these are the things that have been hardest to get. And so the 200,000 that we said we need, they will be providing those to us starting next month.
And that's in addition to our current capacity that we already have?
Well, it'll be in addition to whatever we can get from other sources. Now, the truth is, if we get 200,000 from the federal government, we won't need very many from other sources, and the additional testing that we will do might involve more things like the serology testing, for example, for antibodies. But really, this support that we're getting from the federal government is critically important. And then yesterday, and you probably heard this discussed at the president's press conference last night. I wasn't able to watch it. But they released a blueprint and a plan for testing, which basically is guidance to the states on the things that we should be looking at when it comes to testing. And Dr. Bu had already been working on our plan. The guidance we got from the federal government dovetails very well with what we were already planning to do here in Louisiana. And as you mentioned, for the first time, the federal government, or at least the first time to my knowledge, Dr. Burks started talking about the need to test asymptomatic people. And the reason is we have a better understanding on a couple of things. One is that there is a significant percentage of people out there who are either asymptomatic or mildly symptomatic, yet they're COVID-19 positive and shedding virus, I should say, which means they're contagious. And so as we seek to keep a lid on this and to keep the case number as low as possible, then transitioning to testing these individuals, especially when you have the additional capacity to do it, is going to be critically important. And the second part of that is, and this is a somewhat of assumption on my part, and I'm going to ask Dr. Bu to come up and expand on this, is that they now believe that these tests have more accuracy with respect to individuals who are asymptomatic. Initially, what we were told, and we were told this for quite a long time, is that asymptomatic individuals would be at greater risk for getting a false result. And if they were asymptomatic, then the false result would be that they were negative when in fact they were positive. And Dr. Bu probably has some more updated information on that, so I'll ask him to come up here and share it with you.
Yeah, and you know, along the lines of what the governor was saying, we have a lot more information, not only from national researchers, but just looking at data in our own hands, that there are significant numbers of people who don't have symptoms that are shedding virus, and most concerningly, when we talk about places where people are living in close proximity. For us, the biggest concerns there are nursing homes, long-term care facilities, prisons, and the like. And I think where we've seen the CDC do investigations in a nursing home in Seattle or a homeless shelter in Seattle, both of those studies indicated that at the time that there was an initial outbreak, when they tested the entire population, there was some value to identifying that there were a group of folks who they could identify virus in who had no symptoms, some of whom never went on to develop symptoms, some of whom did develop symptoms over time. And so when we're talking about what's the risk to that population, how do we reduce the likelihood that somebody is shedding and unaware of it and then continuing to spread COVID in that congregate setting, in that close living environment? We think that there's really more and more evidence now that the asymptomatic testing is going to be helpful for those individuals. Now, if somebody tests negative, everything that we said before still applies. They could still very well be in that period of early incubation and not yet shedding virus. And so what we are working with the CDC and others on is determining how frequently we would need to test those people who test negative in a congregate setting, in one of those close living environments, to make sure that as somebody develops symptoms, they're not given this false sense of reassurance and saying, I'm negative, so I can just go on about my day. We want to make sure that it's clear that we need to continue to test those individuals over their period of potential exposure to make sure that they don't develop certainly shedding, and then obviously once they're symptomatic, they would be tested anyway.
So we're talking about nursing homes and prisons and
in the initial phases, we're talking about especially those areas where we think people are going to come in the closest proximity. Now, it still could be happening in the general public. The risk is much lower because the likelihood that you are going to be around such a large number of people that may never have been exposed to the virus is less, because we're all following social distancing, we're all wearing masks. But in those settings where people have to live close to each other, we think that there may be a benefit to actually doing that testing for
Do you think
asymptomatic
we're ultimately going to
individuals.
test all nursing home patients in Louisiana, for instance?
So we'll have to see. I mean, there are still many facilities that do not have any COVID cases. So I don't think I would start going out and testing entire facilities that have no indication that COVID has reached their doors, especially given that while we are excited and grateful that there will be testing resources coming to the state, 200,000 is still not enough to test 4.7 million Louisianans. So we still need to be thinking about who's priority for testing, making sure that those individuals, especially the most vulnerable individuals to COVID-19, get as much testing and head warning as possible. For me?
Actually, for you. Yesterday we talked about this Yale study the Washington Post reported. Did you get a chance to look at that?
I haven't looked at that specific study, no.
Well, they're saying that the death rate from this could be way underreported.
Mm-hmm.
And then the London Times, the Financial Times in London, did a similar study, and they said that they agreed with that. That maybe it might be as low as 60% across 14 countries. How could that be? How is it there could be such a lag, or we could be that far off on deaths?
Yeah, so I think what a lot of these stories are hitting on is that, overall, while we're seeing certainly COVID-related deaths are a new classification that's increasing, deaths in other categories seem to be down. We don't know how much of that is actually that there's lower levels of deaths, for instance, as we talked about yesterday, heart attacks, strokes, or if it's that there are individuals who are dying, we're unclear why they died, and they're being put in this unclassified category. Right now, to my knowledge, we haven't really seen that, where there's this sort of unclassified group. But I think what these researchers are usually doing is saying if there's a group of folks that are dying unclassified, those could be COVID deaths, and thus there's a large number of COVID deaths that we're not characterizing. Again, I can't tell you with any certainty, and I don't think anybody can. What I can tell you is in Louisiana, we have two policies that I think make that less likely. One is we do encourage our coroners and our physicians and providers to, whenever possible, test somebody who they suspect may have died of COVID while they're still able to, within that 3 days that they're with the body. And that will give us some testing data that will tell us right off the bat, were they actually positive or negative. And then we've also given, the second policy is we've given coroners and physicians the ability, if we can't test that body during the 3 days that we have the individual, to say this was a probable COVID-related death. And after we gave that authority and looking through the number of deaths, we only have, again, I think it's something like 59 or 60 probable COVID-related deaths in comparison with the sadly larger number that we have of confirmed deaths. So I think in Louisiana, we're trying to take steps to really be as inclusive as possible and really sort of measure how much impact this is having.
Well, they said that Louisiana was good because the testing rate was higher than most other states, and they expect a spike in deaths in Florida and Texas, who, by the way, are starting to open up. They're starting to reopen, and none of the 9 states that have reopened are reopening right now have met the criteria from the White House. So I guess I'm questioning, why are we paying attention to the criteria of the White House? I mean, I understand we're protecting public health, but...
Well, I'll give you my public health answer, which is, I think that the criteria that the White House put out were developed with the CDC and others who were looking at, the same things that we thought were relevant. People who were showing symptoms of COVID, people who were tested and found to have COVID, and people who are hospitalized for COVID. We are fortunate that we have been able to have a significant amount of testing. We want to do even more than that to put us in a better place. But I think those are the core measures. And I think when you look across states, there's not too many states that are saying we want to look at something different. I mean, it's just that's what you're going to look at for COVID. So I think the White House proposals fit a lot with what we're thinking are the important things to look at. And when we look at that data, as we shared yesterday, we don't see that we yet have what we need to safely be able to have people reopen and go back to aspects of public sector or private sector.
Dr. Bu, is there a scenario or a phase to the new testing when eventually people in the general population who are asymptomatic will be tested, not necessarily people in nursing homes or prisons?
So there's no easy answer to that. What I will say is that any test that we do in a medical setting, actually the way that test works or how much we can rely on it really depends on what we're testing for, how frequent that is in the community. So the longer we continue doing what we're doing, the less COVID there is in the community, the harder it makes to make that judgment about that false positive or false negative test. A situation where you have lots of people with COVID-19, we can rely a lot on those results. As we get fewer and fewer people, you worry that the chances that what I'm seeing is a false positive or false negative increases. So what I would say is, over time, we're increasing our capacity to test many more people. We want to focus on those people in those high-risk settings. But what may also be happening at the same time is that the amount of COVID in our community should continue to decrease, and so it's going to be it's going to be something we're going to have to look at over time. What probably will continue to increase, though, is our interest in looking at the serologies. If people have been exposed to the virus, have developed an antibody immune response to it, that's one where I think over time we're going to continue to want to see more and more of those tests deployed.
Y'all were looking at me, so it's time to come back up. One point I did want to make, because this gets lost on people, I think, sometimes. A negative test, and let's assume that it's a negative test for COVID-19 and that it's accurate. That individual does not have COVID-19. It doesn't mean that individual wouldn't be positive the next day. And so people need to understand that. A negative test doesn't mean you don't have it and you're never going to get it. So if you test negative today and develop symptoms tomorrow, you need to go get tested again, because that's just the nature of how these tests work. And so I wanted to share that all that with you. And with that, I will resume my questions. Yes.
Governor, as the legislature prepares to resume its work, maybe as early as Monday, the Senate President told me this afternoon that he didn't feel he'd been forthcoming with him and with the Speaker of information. He said he's very disappointed in the level of communication, and that he understands that you might have called mayors and other people before you called he and the Speaker. Maybe he said 10 minutes before. I don't know. Obviously, I wasn't on the call. So is that something that surprises you?
Well, it surprises me and disappoints me, because last week I met here in person with both the Speaker and the President, talked about the White House guidelines that we would be following in order to figure out whether we transition this week to phase 1 or not. I told them exactly what that process would look like, and that I couldn't make any commitments at that time, but that I would follow the science, look at the data, and either we satisfy the criteria or we don't. And then had a conversation with him yesterday before coming in to here. And so I don't, I think it's unfortunate that he said that, and I'll be happy to talk to him and to the Speaker some more about that, but there wasn't anything that I, as far as I'm concerned, that should have been a surprise or caught him unaware, because we made a decision based on 14 days. You have to wait until it's time to make the decision to look at the 14 days. It wasn't a decision that I made last week when we had met, obviously.
But on that point, it seems as though legislators are questioning why, if you made the decision Sunday night and just wanted to get confirmation that the White House didn't change its guidelines Monday, why you didn't start notifying the leadership Sunday night when it seemed like things were shifting in the wrong direction for reopening?
Well, we had met with, I had conference calls last week with all any legislator who wanted to participate. We had 2 calls. I had a separate meeting with the Speaker and the President and explained to them the criteria that we would be using, when we would make a decision and when we would be announcing it. In advance of announcing the decision, I got back on the phone with the Speaker and the President. If that's not enough communication for them, then I'll call them and figure out how we do that differently going forward. Yes, sir.
Governor, in an interview earlier, Mayor Cantrell said in regards to 2021 Mardi Gras, I know several months away, that's something we have to think about. That's something that obviously is so far down the road. The landscape's going to change a lot between now and then. Is that something that just has to be decided at a later time?
Yeah, I think, first of all, I didn't hear the question. I didn't hear her response. I'm just hearing what you're saying. Obviously, Mardi Gras 2021 is far enough out that we don't know enough today to hazard a guess as to what the circumstances are going to be at that point in time. I've declined to answer questions about what this fall is going to look like, so I'm certainly not going to go to next January and February and presume to know. But there will be plenty of time to take those questions up once we know more, and when it would be, I think, a better time to address those questions. Yes, sir.
Governor, on the order that's going into effect, I guess, Friday, with the restaurants and allowing them to have the outdoor dining, for those customers, are the inside bathrooms available to them? Is there any, I've had questions about this. And then what did you think of another New Orleans Mayor, Latoya Cantrell? She's saying she's not going to allow that. What's your reaction to that?
Well, first of all, it is always within a local mayor's prerogative to be more restrictive if he or she chooses to be. And so she may have particular concerns that I'm not aware of, or it may just be the urban nature of New Orleans and how, and she has particular concerns about how that might look and function and so forth with outdoor seating and so forth. With respect to the restrooms, I will have to get with my team and talk about it. That's not something that we had a discussion of. And obviously we're encouraging people to wash their hands as frequently as possible. So we may need to go back and revisit it. What we were trying to do was to create just one more option, and that is for individuals who are going to a restaurant to pick up a meal and leave, that if there is an outdoor table where they can sit at and consume that meal, they can do so before they leave, just to try to make it a little more convenient for people, and do so in a setting that Dr. BU and other healthcare professionals believe is much, much safer. Outdoors, the risk, especially if you are a safe distance away from the closest people and you're not having people wait on you. So you wouldn't have an employee bringing you things back and forth from the kitchen or going from one table to the other and contacting different individuals. So that's what we were trying to do. That's one of the reasons we made the announcement on Monday, by the way. So we would have an opportunity to take questions and get those things clarified before Friday, and we'll take a look at that. But I do, since you mentioned the word bathroom, I want to take, it is still recommended that people wash their hands with soap and water as frequently as possible. And so that's something we'll have to look at. Yes, ma'am.
Governor, on the unemployment numbers, is there any concern that the state is depleting its unemployment trust fund at a rate that is going to make it either run out or problematic to refill?
Yeah, well, there's always that trouble when you have a situation like this. You know, we started out at over $1 billion in the trust fund. I think we're still over $900 million in it. And when it gets to right around $750 million, there's a reduction in the weekly benefit that gets paid. And also the incumbent worker training program gets discontinued. And you have different threshold like that. So it certainly is something that we are watching and concerned about, and looking for things that we can do to shore up the trust fund in the short term, and looking at different options that we may have, none of which are terribly appealing, but some obviously better than others. Yes, sir.
Do you know of any local parish officials that are creating reopening plans that are less restrictive than the stay-at-home order, which I would take to mean they're in violation of the order? And also a two-parter, sorry. The $1.8 billion in federal aid, have you made any decisions on how to spend that?
The answer to the second question is no. And obviously the guidance that came from Secretary of the Treasury Mnuchin was such that it can only be spent on expenditures related to COVID-19. It cannot be spent for to make up lost revenue. It cannot be used for that purpose. But now we are working with our congressional delegation and through the National Governors Association and directly with the White House to try to figure out what flexibility Congress may create the next time they pass an act that may retroactively make that funding more flexible. Because if they do that, then it's going to be something that more local governments can take advantage of. And as you will remember, 45% of the $1.8 billion, it was the intention of Congress that go to local government. We intend to be faithful with what that architecture looked like coming out of Congress, where 45% went to the local government and 55% would stay at the state. But we're we're looking to see if there's additional flexibility granted, because right now, quite honestly, local government is not really presenting expenditures. They're telling me they need the funding to offset loss of revenue. That's not an acceptable use, and so we haven't made any decisions on that yet. And I'm sorry, your first question?
The parish officials.
Oh, yeah. I haven't heard of that, and certainly that's not the way it works. If a local official who has the authority wants to do something that is more restrictive than my orders, then they can do that, and that has been done in some cases. But that's not, it's not up to a local official to be less restrictive. Yes, sir.
We just crossed over 1 million cases in the United States, which is 1/3 of all the cases around the world. Are we any closer? The White House said anything about being closer to a vaccine?
You know, the working assumption that I have is that every day we're closer to a vaccine, because I think one's coming. I just don't know when. I did see something, wasn't able to watch the segment. It scrolled across the bottom of the screen, and I don't remember if it was Fox or CNN, that said there are 7 human trials of vaccines underway right now. So I'm going to pray for success with a vaccine that will prove safe and prove effective, and that would be fielded just as soon as possible. I know from conversations that the White House has had going back for many weeks now, that they're not promising that before another year or so, and that is one of the real tricky things about trying to get back to normal, when you have a virus that is so contagious and so deadly, and you don't have a vaccine, and you don't have yet an approved therapeutic treatment either. Unless one just came out, I don't think the FDA has approved a therapeutic treatment for this virus either. And that's really what makes this so different than other things that we deal with, and make it so hard. And it's why we try very hard to keep the cases down, increase our testing capacity and contact tracing and all that sort of stuff, because we don't yet have that vaccine.
Last one.
Question?
Guys, ran out of questions.
Jeff, how are you?
Have you heard from people, whether it's small business people or even mid-sized businesses, saying, you know what, I can't hold out anymore? Even if, I've filed for PPP, but the future just looks so bleak that I just can't hang. I know it's no point in getting my business up and going again. Have you heard from them? Did you get any kind of contact with those kind of business owners?
Well, certainly with the Resilient Task Force that we've created, the Resiliency Commission that has 15 task forces under it, and that's every economic sector in the state. Obviously, we're getting reports from them, and some individuals have expressed that. We are trying to make sure people are aware of the array of things that are out there that could potentially help them. Whether it's the PPP, whether it's the program we have here at the state level on a loan guarantee program that we put together, making sure that they know that their employees can receive unemployment compensation until such time as they can go back to work and so forth. But it is a very difficult time. I mean, there's no doubt about that, especially for businesses who are of a certain type that their businesses have been interrupted. You know, if you own a hotel right now, extremely hard. All of those things related to tourism, and so many restaurants, for example, are related to tourism. This is an extremely difficult time. I happen to be someone who is optimistic, and I know we hear the president say this. I believe that we're going to bounce back quicker than some people might think, but we're just not there yet. We have some work to do. But what I also know is that if you try to forge a path forward too quickly, and cases spike again, and look something like they looked several weeks ago here in Louisiana, you actually do more damage and more lasting damage to our economy than if we try to get it right to begin with and keep those cases down and then reopen in a way that can be sustained over time and can continue to grow. because if you keep going back and forth between hitting the accelerator and hitting the brakes, I think that's the worst thing that can happen. And so it's sort of like, and I think this analogy was used at the national level. This is not a light switch where you go from dark to complete light. It's a dimmer switch, and that's what we're trying to get right, and balancing the need to reopen the economy as we can with the imperative to protect public health. And those things are obviously somewhat in conflict, and striking the right balance can be very difficult. And wherever you strike it, there are obviously going to be good people on either side who say you went too fast or you went too slow. That's why we decided to take the guesswork out of it and apply the science, look at the data, and see whether it met the criteria. But doing it in that approach, we think gives us the best chance to not have to hit the brakes again, and to bring everything to a screeching halt, and it'll allow us to hopefully move forward in a way that can be sustained while protecting public health. There will not be we're not going to schedule a briefing tomorrow. That could change, and if it does, we will certainly let you know. And then we will advise you when the next briefing would be, which I suspect will be Thursday at 2:30. Thank y'all again for coming. I want to thank the people of Louisiana, because they have been incredibly strong throughout this, and done a tremendous job in getting us from where we had the fastest case growth in the country and really in the world, according to Dr. Wagner, using the Johns Hopkins data, to where we are in a much better place today. And if we can continue this for a while longer, I am very confident that we're going to meet the criteria, transition to phase one while we have the testing capacity and the contact tracing capacity in order to ensure that we can continue down that road in a way that is safe for the public. So I do want to continue to express my appreciation to the people of Louisiana. I know this is tough, but I also know that we're strong and resilient, and we're going to get through this. So thank all of you, and God bless.